Welcome to the Abundant Wellness Podcast. I'm Andrea, registered nurse, functional health practitioner, author, and mom navigating the very real trenches of parenting kids with sensitive, complex nervous systems. This podcast is for parents who are tired of being told to just try harder, who feel the grief of realizing you can't fix your child, but still refuse to believe that this is the end of your story. Here, we talk about what actually helps: nervous system-informed parenting, functional health, the gut-brain connection, emotional resilience, and faith in the middle of the mess. See, you're raising a child who's not broken, but deeply wired. My hope is that every episode helps you to feel less alone, more anchored, and better equipped to support both yourself and your child. If you're ready for compassionate science, honest conversations, and hope that doesn't bypass reality, you're in the right place. Let's get started. Hey, everybody, and welcome to another episode of the Abundant Wellness Podcast. Today, we have the privilege of having Dr. Tony Ebel on the show today. Dr. Tony has been teaching and training other pediatric and family chiropractors for the past 10 plus years. His focus is on teaching clinical protocols he created for pediatric neurodevelopmental challenges such as autism, ADHD, sensory processing disorder, epilepsy, anxiety, and more. He is currently tackling some of the most intensive neurological cases from across the world in his Perfect Storm clinic in the Pacific Northwest. Dr. Tony Ebel is a dedicated husband, father of 4, and certified pediatric and wellness chiropractor with over 15 years of clinical experience. Okay, well, we have the privilege of having Dr. Tony with us today. You guys all got to hear my introduction of all the cool things that he does. But Dr. Tony, I'm so excited to have you here. I have been stalking your Instagram page for a while. And part of that, is just our own personal story of recovering our child's nervous system and the journey that we've been on with that, but also as a functional health practitioner, as a registered nurse that specialized in pediatrics. This is where we're going, in medicine. So I am so excited to have you here. I would love for you to share with our listeners a little bit about yourself, and then we'll just dive into all the cool, fun stuff we get to talk about today.
Well, you know what? I feel like I have woken up excited pretty much every day of my life. I'm sure my parents can attest to maybe overly excited to sympathetic dominance and all that. But even just today, hearing you say that, a registered nurse who knows the stuff that you do and does what you do, saying, hey, we're moving in that direction, that adds another layer of excitement to me because, for 20 years, or I suppose just short of 20 years, been doing this work where kind of just, it feels like as loudly and as often and on every platform we can this whole time, we just are screaming from the mountaintops, nervous system, nervous system, nervous system. And my journey actually into this work started truly as a parent first. Got married in chiropractic school, met my wife in undergrad, like right before graduated undergrad. Life just moving fast as it always does. Got married, moved to chiropractic school. So my beautiful wife, Christina, gets to live in Davenport, Iowa. Wonderful, amazing place. And we really couldn't wait to start our family. And we did. We started young. And so the journey into talking about the nervous system with pregnancy and birth and labor and delivery and our babies and our kids actually started on a journey of really watching it go awesome, really watching it go great. That pregnancy was super healthy and, a great time in life, but not too much stress. So we were getting adjusted and doing all the things. And then our oldest daughter was born 2 weeks before graduation and everything just really went well, to be honest. It was like this perfect story kind of playing out. And I actually got hooked on that. I think a lot of times now, if people go through and stalk our Instagram and our podcast, they know that our specialty is the far other side of that. It's the perfect storm of kiddos really having a lot of stress on their nervous systems through that journey and leading to a lot of struggle for them and the family. But it's really by the grace of God that my actual catalyst was all the good. And I have had that contrast. I've held on to that contrast the whole time, which really I think is the foundation of our commitment to go into the storm of stressed out nervous systems, whether that comes with a diagnosis of autism or epilepsy or whether it doesn't matter to us. It just matters that we get to the root cause, we educate, we empower, the parents and the kiddos to understand this. And then we do the work to move them forward out of the storm. Because if you get the nervous system moving forward, you're also, this is, okay, I'll leave my other favorite of neurology and go to my other nerdy favorite of physics. If you're moving forward, you're also moving away from the storm. So we just keep working on that every single day in all the ways.
I love that because you're absolutely right that most of the stories that we hear out there, the catalyst is usually something painful, right? Or bad or negative, or like in our case, what woke me up was my own child being vaccine injured. Actually, both of them were injured in the same appointment. And we can talk about this on a podcast because it's not a public platform,
that's
right? On social media. And that's really what started waking me up to what I had already been seeing in the hospital, but I didn't have language for it and there was no room to talk about it. So I love that you had a positive experience that helped to kind of shape when you know what good and healthy and normal looks like, you won't really accept anything less than that, right? Like,
That's right.
Or we shouldn't, in my personal opinion. And maybe I don't feel like that's too high of a standard for our kids. And I think that I'd love to talk about the really big, juicy question, which is why do we think this is happening? But maybe we'll lead into that a little bit. So you work with a lot of the really challenging neurological cases. Are most of these families that come to you, are you like their last box to check, like they've tried everything else, or do you kind of get a mix of everything?
Goodness gracious, what a cool question, because for the majority of my career up until recently, which actually would even apply to us talking about the vaccine injury and the birth trauma and the fact that even up until recently, there was only a few places we could talk about. And if we were talking about it, I love what you said there too, is do we have the language? Do we have the verbiage to even make sense of this? And I think we all are coming together on this. These things we've been watching and knowing are happening. Okay, can we explain them? Do we have the terminology and the understanding? And then can we actually talk about them without being shut down and dismissed to them? So yes, in the beginning, we used to joke that our crew in the office should answer the phone, welcome to the last resort. And the first 10, 15 years, we meant it to the T. I got my start not even getting to help babies and 3-year-olds and 4-year-olds. They were 17, 18, 19, Asperger's, autism, epilepsy diagnoses. They had literally done brain surgeries and every medication that had been invented. And then they would find our work and they'd come to us. Thankfully, OMG, God is moving mountains. Today, we're not always last. We might be second to last or in the middle, but it actually woke me up. Oh, I wish I'd have recorded this date. I was on a phone consult and, our nervous systems wire for the things we do. When we chat with parents, we are never, ever, ever, ever scripted, but you have a certain flow to a consult you take as a provider, right?
Right.
And you see a lot of the same cases. You end up using similar analogies or metaphors. And it was that day that I literally said to this mom, she was calling me her 5th grader, ADHD, had really, the struggles had been brewing for years, but it really reached a head. Every grade gets harder for these kiddos and the school was pressuring her. That was kind of the consult. And I think I said something exactly like this. I said, we joke around here, we should answer the phone, welcome to the last resort. That mom cut me off in my tracks awesomely and said, oh, no, Dr. Tony, you're the second to last resort. I know that if I go to another IEP or if I follow this, referral they've given me, if I go to a neurologist, they're not going to look at my kid. There's no blood test. There's no nervous system test. They're going to have me fill out a survey and I'll go home with a prescription of a class 2 narcotic within 2 minutes. She goes, that's my last resort. And I'll never forget that consult because that kind of woke me out from, I was watching that happen. I was watching moms of our generation and dads of our generation start to reorder things. But it was that phone consult where I was like, I think I can.
Happening.
Yeah. And we're not going to stop until we're first. And that's not first because we're best. We're just, the nervous system is the boss.
Yeah.
And if you start there, you get transformative care from that. And then every other provider and intervention you do in addition to that works better. So it's not a hierarchy of who's best. It's a sequence of what helps our kids the most.
Yeah, it's helping people to really understand. It would have changed everything in my career, everything, every interaction I ever had with a patient or their parents, if I had truly understood the nervous system.
Wow.
Everything. And that's not an exaggeration. Like, I'm not saying that for a sizzle reel clip,
No, I get that. I would sneak this in there because the other part of my story that was such an advantage. So I had the Addison advantage, this beautiful baby girl who's now going to college here soon. And, just everything going great. So that was my set point. That was my compass. And then also I went to chiropractic school, and chiropractic school is all about the nervous system when it's taught to you correctly, right?
Yeah.
And so you get this education that comes with a not medical philosophy. And then you get an education that comes with a nervous system through line all the way through it. So you enter the world, both actually as a provider and a parent, you enter the world with a different set of lenses.
You do.
That you use to interpret everything. And so I think it's a hard thing for chiropractors and nervous system people a lot of time to go. And this is what I pray to God for every single day. Like, hey, make sure when I'm communicating and empowering and educating that I'm not starting with my lenses and my shoes already on. I need to go to their perspective, their understanding.
Right.
Yeah. And find them there.
Absolutely. And finding that middle ground is really important because we have to, nurses I think we're trained very heavily in like assessing first, even before you step into the room, you're making an assessment, right?
Yep.
And assessing where the gaps are, like where's the gap in education? Where's the gap in knowledge? Where are they coming from? And part of the reason I love to do that personally and professionally is because so many of these parents are coming into an appointment with a high amount of anxiety because of what they've been through, and a very big lack of trust in, like, they're hoping that we might be different, but they don't know that we are yet. And so there's a huge lack of trust that I personally love to be the one that rebuilds that, because it's like, if anybody knows conventional, it's me. Like I've lived it. I've worked it. I thankfully came out of that system and launched something different. We chose a different path for healing for our kid. And I don't even want to think about what our life would be like if we had not taken those leaps, right? But meeting people where they are, like knowing that we have, as much information as we do, it helps to rebuild that trust for people.
Yeah.
And it helps to give them, I think, some of their power back, right? And where they've had to lay certain things down because they've been dismissed or ignored or taught to, ignore their own gut feelings about how their child is doing. And you just have to accept that this is how they're going to be forever. Well, I'm sorry, that's not good enough.
It's not. And that's the first foundational step in nervous system healing. We're actually talking about the nervous system here, because if you don't do that for the parents and the kiddo, you don't move their nervous systems out of that triple gated, deep moat of neurological protection, which again, you and I fully understand how they got there, what the storm was of, dismissal and belittlement and just accept this. There's nothing you can do. And then also, let's call a spade. A lot of other providers, especially in today's world, will get out there and they'll start talking about root cause, but they're maybe one layer beneath the surface instead of all the way deep to the nervous system. So parents today have not just been let down by conventional medicine. Often they've been let down. Yeah, there's kind of a longer list of, And so it's cool to see their nervous system shift towards healing when you rebuild. I love what you said there. When you rebuild that relationship with hope and confidence in themselves, honestly.
Right. Parenting a child with ADHD, autism, PDA, anxiety, or ODD, and you are exhausted trying to figure out what's actually going on, I want you to hear this. Many of the kids I work with also struggle with symptoms like constipation, diarrhea, bloating, skin issues, or brain fog. And while it can feel like the behavioral and digestive pieces are separate, they're not. They are deeply connected. And that's why the Happy Tummies, Happy Kids program helps to resolve this problem. It is a 4-month root cause approach program that looks at your child's whole system through a functional lens, not to change who they are, but to improve their function and reduce suffering regardless of the diagnosis. If you're wondering whether this kind of support is right for your child, the next step is to book a Strong Start discovery call. It's a conversation with me to understand your child's unique needs and see if this program is a good fit for them. You can schedule a Strong Start discovery call using the link in the show notes. You don't have to figure this out alone, and I look forward to hearing from you soon. And that comes with allowing people, I think, to bring in some of their defenses, right? Where it's like, I have questions for you. Awesome. Those are the parents I love because they're the ones that are coming in. I don't get defensive on that. I don't get like self-protective on that because I'm like, that was me. And I wish I had the voice that you had 10 years ago, you know?
So true.
And so I'm here to listen to that and I'm here to answer your questions. And if you challenge me on something and I don't know the answer, then you just dangled a carrot in front of my face to find it. Like,
Yep.
you
I'll be
just
up late
gave
at night and
me,
I will report
yeah,
back
I'll be
tomorrow by
awake
noon.
3 o'clock in the
Yeah.
morning trying to
Yes,
figure this
ma'am.
out.
Yep.
So thank you for that. Like, I really do appreciate when my clients do that because none of us know everything and none of us practitioners have every piece to the puzzle.
No,
So
no.
I have a question for you on this. So when a kid comes in, because you're working on, structural, you're working on the nervous system, you're working on, this is my rudimentary explanation of what you do, manipulating things, moving things around, adjusting, assessing where the nervous system is stuck, right? How
Yep. Yep.
important is it for you in your role, in this role, to know all of the trajectory, where they came from, where
Ah,
injuries started? Like, does that play a huge role for you? Or are you just like, I just kind of need to get my hands
massively.
in there? Okay.
Massively. You would test out of the certification course here, my friend, by thinking the arc that I can tell you're thinking on. So there's a 3-step process. There's a lot of steps within each of these three, but we can kind of take a 10,000-foot view with our clinical process. And over all these years, and it's the first thing that literally changed everything for me. If we didn't get this one dialed in and had an incredible mentor, Dr. Cody, who taught me to do this, you get this one and it opens up everything after this. And the first thing we do is we really dig deep into that
Love it.
case history. So that's where the perfect storm came from. And parents right away, the thing we were just talking about happens instantly because as soon as you go all the way back, I mean, we talk about conception, fertility, we go all the
Right.
way upstream to nervous system development. We could even get into epigenetics and other stuff with certain cases. And moms and dads today, by the way, are ready for this.
Yeah.
They've always been ready for somebody to really go deep into the root cause. And now they're highly educated too, thanks to podcasts and everything else. So
Right.
it really matters to us, Andrea, that we do that because we start to know two things so we call that CSI, chiropractic science investigation.
Nice.
We're nerds. Our metaphors are quite lame.
I love it.
We
I think it's great.
we get into that. We go, okay, I'm looking for depth. The earlier that a child's nervous system went through these perfect storm stressors, and we can do that later on. What are those things? The earlier they went through these patterns, the more we know the nervous system's going to be locked into what we call these stages of subluxation. So honestly, most of the cases, especially after doing this for 20 years and teaching others to do it, the next thing we do, so that was step one, a deep CSI. The next thing is the scans, the exam. So we use incredible technology and a really in-depth nervous system dysfunction, dysregulation, dysautonomia exam. And the coolest thing about this technology is we can literally measure it, map it, score it, locate it. Well, I've done enough of this two-step dance that after I take the case history, I could probably grab my kiddos' markers from their school bag and draw out the scans. I've done enough clinical correlations to the challenges to see what the scans are going to show. And then the third thing is the plan. So the third thing from our assessment is, so it's case history, in-depth, CSI, scans and examination, step 2. And those two things put together give us our personal, and when I say personalized, man, we mean that. Personalized, customized care plan, which includes frequency, duration, adjusting techniques. And here's the other thing that I know your audience could get. I wouldn't always get into this with the regular tribe, but the other thing that we have now found is essential for us to do with our patients with nervous system healing is what we were talking about right out of the gates. They have done so many other things already, and they're probably coming to me, again, not last resort anymore, but kind of caught in the middle, and they're probably doing 3 things, 10 things, 30 things.
Right.
What we have found with nervous system healing is if you don't clear space for nervous system healing, at least in those first 30, 60, 90 days. So a lot of the times our plan that we help parents and patients go through with nervous system healing isn't only about addition of chiropractic adjustments. A lot of times you need to be able to say, hey, this thing over here is amazing and it's awesome. And I know on the Facebook group, and the white paper you downloaded and the seminar you went to, these kids had results, and these over here, it's a really detailed science as to why which kids respond to which interventions, because it's all about the order. It's all about the sequence. And so oftentimes we're really going to an in-depth conversation that says, hey, these 3 things are amazing for your kiddo. They fit their case history. but they're not going to help yet because the nervous system is so offline. It's so
100%.
dysregulated and so exhausted. So a lot of times parents leave our reported findings, I would almost say duly hopeful. They now have this missing piece, this missing foundation of nervous system focused care. And they also get a little bit of deep breath relief where it makes sense why the detox hasn't worked yet or why the speech therapy hasn't kicked in. Not that they're not going to work and not going to be needed, but there's just this hierarchy, this sequence to healing.
Absolutely.
And so that's a really probably granular answer, but it's the
No.
3-step sequence that gets us down to those granular details.
It's important to talk about it though, because there is, just like in physiology, we have order of like organ healing, right? Or ways that blood moves through different, it has preferences and pathways, right? The nervous system also has that. And it's one of the reasons why, I'm in the functional medicine space. I love to kind of help people to understand pacing because we cannot outpace the nervous system the same way we can't outpace the immune system or how quickly the body's going to heal. And as a parent who's had to walk a kid through pretty significant injury, right? So PANDAS, which is, in my opinion, from what I've seen clinically, some of the worst regressions in every single system of the body. Like it's not just the mind that's affected, it's every system.
The most difficult journey is to get better because it's so roller coastery.
It is. And that was the hardest thing for me to really internalize, not just know up here, but like internalize, like my desire for her to be better cannot outpace her own ability to heal. And so that's where I really leaned heavily on my practitioner. Like, can you help me to see what I need to let go of right now? Like I had to like get out of my own way as the parent, which is the hardest thing for us to do because our own nervous system is very, very activated, like by what our children are going through and the struggles that they're facing. We can't minimize that. And I've talked about that in other episodes.
Yeah.
It is the hardest thing to do. And I think it keeps me in a place of humility also as a practitioner because I've walked one of the hardest roads in recovery for my own kid. Not to like toot my own horn, but it's not hard for me to sit in that space with parents and be like, let's settle.
I'll sneak this in there. I'll sneak this in there to bring this up. When I was an undergrad, I knew I wanted to go be a chiropractor. I didn't know anything about it, didn't grow up with it. And so I was a college student, so I needed a job. So I worked for a chiropractor, a really incredible old school chiropractor. And upon graduation, he took me out to dinner, and was sending me off to school. And he was so amazing, Dr. Rick Albert. And he said, I got to just say this to you. And he goes, I wrestled with saying it out loud, but it's just so true that I'm just going to say it. And he said, and we'll see where God takes it. And boy, did he turn to be, quite prophetic in this. He said, you really understand the power of nervous system healing, chiropractic, when something really tough, a real health crisis hits you or a loved one. And I remember him saying it that night at dinner. I was 21, 22 years old. So it didn't land or too much, at that time. And then down the road, this perfect storm thing would happen because Addison was the perfect story, but Oliver was our birth trauma, seizures, medical, NICU, 6 weeks. And had I not, same thing there, Andrea, had I not walked that path with my own kiddo, including the other mentor I brought up, Dr. Cody, was the one I needed to listen to that whole time so that my parent pacing, which kept trying to run the car into the ditch, stayed on track. Yeah, you nailed it. And the way you said it is beautiful and accurate. It's why God now has you in this incredibly impactful space as a practitioner and a guide for these families, because your feathers are way less easily ruffled having gone through what you went through.
It takes a lot.
It does.
It does. And like, it's like that. What's that? I think it might be from Pirates of the Caribbean, where there's this scene where this guy is like walking off the ship and the ship is just exploding in pieces around him. And he is like so unfazed by it. I'm like, that is PANDAS.
That's a great analogy. I just watched all those movies with my youngest daughter. Yeah. She finally crossed the age threshold to watch those over the Christmas break. So you're perfectly accurate. Yes, absolutely.
Yeah, and it's why I love working with these parents. They have a level of grit that you really can't understand unless you've walked it. Like it's a very unusual. There's something very unique about families that have had to walk, and just the family unit. And there's something really beautiful about the grit that we develop in those places. And as the parent, I mean, that your nervous system gets immediately activated into that sympathetic state where it's
Yes.
like fight or flight. I must fix this now, right? So
Yeah.
I want to ask the really loaded question because I
Okay.
know what I think about this, but I want to know what you think about this. Why do you think that we are seeing such an explosion
Yeah.
of neurodevelopmental disorders? Because I can tell you from the day that I graduated nursing school, I went right into pediatrics, 2007, up until now, I saw maybe one or two
Truth.
in my caseload, right? In, months over months, where I would have a child that was on the
Wow.
spectrum or that had oppositional defiance disorder, behavior issues. Like it was a rare
Yeah.
thing. Fast
Yeah.
forward to when I left the hospital, like I don't know what the studies are showing, but I can tell you by my observational, but my just little pool of, we
Yep.
work in an inner city hospital. That's a lot of kids. You could not prove to me that we're not seeing an explosion. I think
It
is what
is.
I'm trying to say. So I'm curious
Yeah.
what do we think is contributing to that?
Yeah, well, we know it. We have known it. It's not a confusing equation anymore. And it's also not a singular equation, which also makes it tough, right? Because so I'll start this off with a storyboard as well. I'm on the same journey as you. When I first started studying and taking my advanced pediatric training, it really motivated me through situational observation. I'm just that kind of person who is always looking for patterns and looking for root causes, probably why God knew to, make me a chiropractor. That's our
Yeah.
obsession. And so I had nieces. I'm the youngest of four, so I had nieces and nephews and cousins and all this. And I'm just looking around and I'm like, everybody is sick. They're not kind of sick. These kids are super sick. And they're not just having like regular meltdowns and tantrums. They can't sleep. They can't focus. Their speech is not coming online. Like I noticed real early in my education into my career that this problem was exploding. Well, then I sit in the classes, then I do the research, and boy, there it is, just sticking out in this right in the middle of all the chaos. It's literally it's exploding. Autism exploding, ADHD is exploding, sensory is exploding, autoimmune disorders are exploding, and a lot of kids, they got all that and then some. They technically fit that whole alphabet soup. So here's what it is. It goes all the way upstream. What we know is at play is the toxic overload. When I first got into this work, my sequence went from, conventional medicine says it's genetics. Well, guess what? I'm ultra nerd. My undergrad studies were molecular biology and genetics. So I had access to all the looking for answers in the genetic box, resources, found none. When it comes to neurodevelopmental disorders, zero. I mean, they're not there. Then I go into the holistic world, right? Chiropractic is right there with all of us, right? Functional med and holistic and natural. And I start seeing all the charts and all the studies, and I start learning all the neuro, gastro, immunology, neuroinflammation, microbiome disruption about toxins, whether inhaled, so air, ingested food, water, processed foods, or injected. I always say it that way in our podcast. Kids and chemicals don't mix. They should not be inhaled, ingested, or injected. The earlier they are, the more trouble. Then I get into practice, and this actually goes back to what you're talking about. And I go back to doing CSI, as Dr. Cody taught me. And I know I'm not going to look for genetics. That's not there. I still did my job, and it's not there.
Sure.
And then I kept looking for the injury. I kept looking for the 12-month, the 18-month, or whatever it was. And I found so many of them. But I found two other things first. Number one, about 60 to 8, if you go with COVID kiddos who were born over those couple of years, went through pregnancies through those couple of years, there is so much distress, dysregulation, and dysautonomia put on moms' nervous systems
100%.
today. So fertility to what's called maternal distress in the literature, mom's nervous system is baby's nervous system. That umbilical cord is the power cord. So if we leave moms, as we've medicalized pregnancy, we scare the ever-living heck out of you about getting pregnant, being pregnant, managing the pregnancy, labor and delivery, and it's going to be horrible, so we're going to intervene. We're going there next. That's number two. So you have this pre-wiring of sympathetic dominance, and there is research galore that proves what we've seen clinically. So like you said, you started to see these correlations. That's what we saw in practice, and then we know the research that this fetal distress, it literally overstimulates the sympathetic nervous system when the baby is most sensitive, most plastic in utero. And really what it does, it's the same thing said differently, it actually suppresses vagal nerve, so parasympathetic development. If our babies are in this constant state of distress, like we all are, well, the body, it's how God designed the nervous system. The nervous system is going to start to mold and wire itself in preparation of that. If that first many months is so stressful and chaotic, what's the baby's nervous system supposed to expect about the outside? The same thing. So
Not
you
better.
hardwire, it's fight or
Not
flight.
easier.
It's crazy. So we can measure this with HRV. We can turn this around right out of the gates with pregnant moms. And the second one, I know I went off on that one. The second one's actually probably like if you spill me open and you say, okay, God, what did you put Tony here to do? It's to really get the world to know that birth interventions, and so often they're life-saving. My son went from one hospital in a helicopter to another in an ambulance. I have seen what you do or did, probably, I guess is probably better, right? In the hospital. I have seen, and it's always the nurses who get the job. I'm not saying this just because I'm with you. I would talk to the doctors and I'd be like,
I was like, are you? And I would say we do the things. We do the things. So,
even understanding, I would talk to the doctors. I'd be like, "Did you clock in today? Do you know my son's name? Let alone what's going on in this case?"
Because I feel like maybe,
yeah. So the nurses were the answer. So I spent 6 weeks there. So the birth interventions: forceps, vacuum, cord wrap, C-section, planned or emergency, vacuum. These epidural induction is actually a big deal. And all of these, we can map out the neurophysiology because it's injury to the brainstem. So this is where chiropractic shines. It's physical injury, yanking, twisting, pulling to the brainstem. That's where the vagus nerve is. That's where the autonomic nervous system's air traffic control is. That's where the cerebellum is, which controls all motor and sensory processing. Right. And motor and sensory is the most important thing to brain development. And so here's what it is. Those two things, we call this the perfect storm. And you can chunk it down to 3 things: high stress during pregnancy and fetal development, physical, so that'd be emotional.
Yeah.
Physical stress and injury to the brainstem, the neck, and the spine at birth. Right. And then what chance does that kiddo's nervous system have to withstand the toxic overload? Because the nervous system controls the gut and it controls the immune system. So when it's already stuck in sympathetic dominance as an infant from day one, gut motility is shut down. That's colic, that's indigestion, that's acid reflux, that's constipation, that's eczema. So the pediatrician says, oh, that's normal, they'll grow out of it. No, they're growing into this, and then they're inflamed.
Integrates into something else.
It does. They call it something different until a child is 3. They can give you a neurologist or a early intervention. You graduate out of early intervention. They give you a diagnosis. And the whole time, colic, constipation, eczema, chronic ear infections, then it's antibiotics and steroids, which wreak even more havoc on the neuroinflammation system and neuroimmune. And so all this perfect storm is brewing from those 3 factors the whole time. And it spills over into a neurodevelopmental disorder.
One of the biggest and most easily fixed issues that I see in parents raising neurodivergent children or parents of children with a complex medical diagnosis is actually mineral deficiencies and low electrolytes. When we are under chronic stress, as raising these children is chronically stressful, we run through our electrolytes and our minerals very, very quickly, which then puts a lot of stress on pretty much every organ system in the body. So one of the things that I teach a lot of the parents that I work with is a very quick action step, which is to just grab a scoop of electrolytes and add it to your water 1 to 2 times a day. It's one of the easiest ways that you can nourish your body so that you don't end up in a state of depletion. When we are mineral balanced, when our electrolytes are balanced, we sleep better, we respond to stress better, we bounce back a lot quicker from events that are really stressful. So one of the electrolytes that I use is Paleo Valley. They're super duper clean, no food coloring, no yucky ingredients, super affordable. I have a 15% off link for you in the show notes. One thing that you can do to care for yourself today is to grab some electrolytes, add it to your water, and remind yourself that you're worth nourishing too. That was probably one of the most succinct ways I've ever heard that explained. Those are the thoughts that jumble around in my head when I try to piece it all together and make it make sense for people. It's not just one thing, right? No. It's not just I'll just share, and I've shared openly about this before. This is not new information. It's in my book, it's on social media, as long as they don't report me or take me down for it, for whatever reason. My oldest was, She got all of her injections to date up until she was her kindergarten shots. And at that appointment, it was that appointment that I was going to tell the doctor we weren't doing anymore.
Yeah.
Like this was the last one and we were done. Because I had a brand new baby at the time. And I was like, I don't have peace about this anymore. Like something in my spirit is deeply unsettled. And it was that one thing that tipped, but it wasn't the one thing. It was the one thing for her. It was that was the straw that broke the camel's back that led to autoimmune susceptibility.
Yeah.
That when she got strep 2 years later, her body was already completely overrun. And so I think this is where that initial conversation with families is so extremely important, because putting together the timeline for them of, this is what I see, this is what I'm hearing you say, this is what makes sense to me. Now let's work with the body to reverse it. And that can be, I mean, I remember the first time I sat down with her doctor that said, I believe you. I believe you. I'm going to run the testing to confirm it, but she has PANDAS. I believe you. That I just started crying because it's like everything in my system knew, but hearing somebody else validate you and say, I know how to now carry you through this, right? Like that's a completely different emotional, like you can lean into that trust a little bit better. So I have another question kind of in regards to that, because I think the listeners, I want you to, if you have not already, go back to the episode on grief where I talked about processing how your child got to where they are, because there's a lot when we listen to something like this that can get stirred up on the inside that's healthy for you to process through. None of this is shaming. None of this is pointing the finger. It's identifying how we can help your kids get better. And we can't do that if we're not honest about their trajectory, right? First with ourselves and with the people in front of us. So I want to just provide a little bit of a buffer for that. But and this is why I love connecting with other practitioners who do all the things I can't do, right? Like I can't go to school for chiropractic right now and get my hands on all the things. And I wish that I could.
We would take you though. I promise you that. We would definitely take you on day one.
I will never be tired of learning. So it's anyone's guess where God's going to take me next. How does working with the nervous system, is kind of a loaded question too. I see it very much as necessary and complementary to anything that we do functionally. So like if you're doing occupational and physical therapy, right? Reflex integration therapy, neurofeedback, working with somebody on, let's say your kid has bacterial dysbiosis, right? And they have infections in the body that they're not clearing. To me, it's extremely important that all of the systems be addressed. I can't work on their nervous system in the way that you can. So how do you see that be like synergistic when you know that a family's working with a good practitioner, let's say like legit root cause work, and they're on a good protocol? How do you see that be? Because I see it work beautifully together.
I think it's the most important question and conversation to have today. Obviously, everything we just went through is how you first go through things to be able to help a family. But once they have those answers, and actually, I just want to say something about that, even from a parent perspective too. That episode is so essential. I can share this on a story too, just for relatability for every parent, because it is. When you go all the way back in here, you start to piece the puzzle together. The way we do it is, and the way we pray and work our butts off to do it, is in a very empowering, forward moving. Now you know what's been missing. Now we know what to do. So often, and I'm a simpleton, I'm an Iowa farm boy and a dude, so I probably can process these things sometimes a little easier. But the bad news is the good news. As soon as you have that dialed in, you can go, oh, here we go. But I've also lived it. When Oliver we had this perfect pregnancy, perfect birth, perfect baby, latching, breastfeeding, healthy, everything going on, right? And then 2 years later, Oliver has a traumatic birth and he's in the hospital, and they want to do this and this and this and this. And my wife and I, we're in Crystal. Anyways, it was about a 45-minute drive down in the city for this hospital. So every morning, sometimes we'd stay down there, sometimes we'd come back, and we were driving down there, and we had these CDs. I've aged myself here, Andrea. We're listening to CDs that we used to put into our CD player, right? Instead of podcasts. And these chiropractors were interviewing this actual heart surgeon, right? So he's this guy who was a cardiac surgeon. He did heart replacement, heart bypass surgeries, and then he moved into wellness. And I'll try and tell this succinctly, but it's so important for the grief side. It's so important for the emotion side, because it changed my life that day. And he said, what I found, the reason I moved into wellness, talking about the nervous system and nutrition and fitness, he said, after 20 years as a heart surgeon, It was, how in shape are you going into the crisis, and how willing are you to get even healthier on the other side of
So
the
good.
crisis? He said,
Yeah.
it's the heart is not the product. He said, I can take, because he said some people, they had a terrible lifestyle and that led to them to be on my table. But other people truly had some genetic abnormality. They were the runner and he said, those who went in healthy and then left determined to get healthier, their outcomes are insane. Those who came in unhealthy and then had no desire to change anything on the other side of finding out as to how they got on my table, he goes, guess what? They didn't make it. We did the same surgery. We used the same procedures, right? So I don't know if it was a moment for me. My wife and I very much felt blame until that morning. We felt, oh my goodness, God, we did everything right. We're this chiropractic, holistic, home birthing family, and we're in the NICU with a kiddo having seizures and facing this diagnosis. It was that perspective of, and it shifted us to go, what if we hadn't done so many things to be healthy? Where would he be then? And what if we didn't know so many things we can do going forward to restore health?
Right.
What do we do then? Okay. So I had to share that.
So good.
So
I love that. And I think it's really important to, like you said, because there is that initial, we all have an initial response, right, to that. And I still have moments of like where grief hits me and it's like my one regret.
I know.
And yet it's like that verse in Philippians, I think it's Philippians. I'm terrible at addresses.
So am I. I remember the context, but I never remember the verse.
Keeping my eyes straight ahead, looking at the forward goal, right?
Yeah.
And I can't change what's back there. So there is some radical acceptance we have to do. Make sure to go back and listen to that episode. But anyway, continue. I know we've got
let me go. So
left to tackle it.
So we're layering things in. This might be, goodness gracious, my friend, this might be our foremost specialty nowadays, because I don't find you have this, and I'm starting to pick up other providers who do this, but man, no matter the provider, no matter the initial, no matter our specialty, if we don't understand what we're going through right here, we're all going to have limited results instead of optimal results. So nervous system foundation, actually, to really get parents to understand that as to which interventions go first, then next. Well, first, it is very customized to the kiddo, but I'll say that there's a lot of similarities to the path that we just went through, the perfect storm, right? Most kids are taking some or all of that on. So the neurophysiological dysfunction tends to show up in the same sequence and pattern. The system that is carrying the most amount of destructful stress is what's called the neurosensory motor system. It's said easier, it's the motor system. And right now, Andrea, it's the motor system that is the forgotten middleman, foundational man. We are rightfully so working on the microbiome, methylation, and mitochondrial function. But the way God designed kids to develop, and honestly, just humans to be healthy, movement is life. When you move the body, but more specifically, when you move the spine, these tiny little what are called stabilizers or mechanoreceptive muscles and nerve fibers within the neck, the brainstem, and the spine, they send into the brain something called proprioception. Proprioception is the perception of movement, and it's calming, and it's integrating, and it's organizing. If you ever been stuck in traffic or stuck at your desk for 8 hours, how's your brain function? Awful. How's your mood? Awful. How's your energy? Awful, because you didn't move. Well, kids need that times 100, and they need to do it in a specific sequence. So it's the movement of the neurophysical, neurostructural body, and the spine is the hub of that. The brainstem is literally where 60 to 70% of all movement stimulus into the brain goes. So what we actually find when we examine kids, their gut, a mess. Their neuroinflammation, a mess.
Terrible.
They're a mess. But worse, and I don't speak in this, I'm such a glasses half full guy, but I got to get the truth to the truth. What we actually find nobody has picked up on is their neurosensory motor planning. And it goes way beyond a weak core at toe walking. We're talking about their neuromotor system. And here's why it gets missed. Because eventually the brain is so hardwired in a kiddo to get on 2 feet and start to walk and run. They'll do it, but they don't do it well. There's a whole conversation called quality of movement and their posture and their tone and their coordination.
So important. Yep.
What we fix is that first. It's that big muscle, neuromuscular system. That's why the little muscles of speech can't come online. The brain is so primally, it's so connected to motor planning, sensory motor input, that if we're trying to heal the gut or get inflammation to chill out, but that one system is still a mess, it will be a ball hog. It will stop speech, OT, physical therapy, and often even detoxification and gut rebuilding. It'll stop all that from working because I'll close with this. The nervous system, the brain has a project management system to it with development and healing. It knows it can't fix everything at once. And it knows it has to fix that system first because the gut is a muscle. The lymphatic system is a muscle. We need movement for detoxification as much as we need movement for sensory integration and development and brain reorganization. So it's really about getting the brain and nervous system. So we'll often take chiropractic only. We'll often have a kiddo come in. I have an intensive program, kids from out of country, out of state. They've done everything. It was our conversation from earlier. And I'll say for the next 2 weeks or sometimes the next couple of months, we're going to hit pause on everything else. So that when we come back to it, we're going to get more out of it.
Absolutely. This is how you know you're working with a good practice, in my opinion. More is not better.
No.
And especially the more sensitive the case, whether it's autoimmune, neurodevelopmental, whatever, the more sensitive, the more easily triggered, the more, disrupted they are by their environment, the slower we have to go. And that's not a bad thing. Like it just means being a whole lot more intentional as the practitioner. And I know what that looks like for me, on the medical side of things, but from the physical side of things, I went through a season of receiving neurofeedback for some of the PTSD of raising a child with PANDAS. And I noticed I was holding my adjustments for longer. And it was the weirdest observation. I was like, that's like the first time in my life that I've actually, and I knew that on some logical level, right? Totally. That would make sense. But it's so interesting to see how all of the pieces fit together. And I know that, I think we only got to like 4 of the questions today, but this was such a good conversation. I know that all of the parents that are listening are really going to benefit from not only your personal story, but I think just hopefully being encouraged to know that there is a whole heart of practitioners out there that really, like, we are fighting for better, and not just in the conventional realm, but also the whole, like, we see what's happening with the not so good things out there, even in the holistic space. And we want better for that too. And so if that's your only takeaway, let that be your only takeaway, that we really do care about your families and your children. I'm going to make sure to put in the show notes how people can find you. Where is the best place for people to land?
I love the podcast, the Experience Miracles podcast. So it's as nervous system and nerdy and hopeful and faith-based as yours. I love it. I think the folks that love your work are going to love the Experience Miracles podcast. And then because I'm in my mid-40s, I want to say Facebook, but my team would tell me to say Instagram. Yeah, our PX at PX Docs on Instagram is very hopeful, very educational, and it's a little bit entertaining. We like to have some fun over there too.
Yeah, you guys do have fun. I love your page. I think it's fantastic. I learn something new every day. So thank you so much, Dr.
Thank you for having me
here.
Oh, I love it. This is incredible. Keep it up. You are doing the most important work. It is, like we talked about here. It's our stories that wove together this certainty and our ability to stay calm in the storm with those families. That matters so much. So thanks for having me, Andrea.
Thank you so much. Well, safe travels, and we'll be in touch soon, okay?
Perfect. See you.
Bye-bye.